Hey, righto, let's have a look at some of the magnificent work that SPORTSMED SA does. Like SPORTSMED SA on Facebook to keep up to date with the latest news and information. And we popped in there during the week.
So, Pat, you worked with Port Adelaide for a long time, and when you were with Port, what sort of common knee injuries did you used to see?
Well, we'd see quite a few different things, but the ACLs, anterior cruciate ligament, was always the one that was given a lot of profile. But you actually only probably see one or two of those per team per year, so not as frequent as you'd expect. Although, you know, with the women's, it'll be very interesting to see. So.
Yeah, because I mean, we know from basketball injuries or female netball players and jumping sports that there's a high incidence of anterior cruciate ligament injuries. Probably the most important thing. What sort of things would you recommend to your patients to try and help decrease the possibility of having a knee injury or an anterior cruciate ligament injury?
All the programs they've got in place in the soccer and the netball are about landing, so yes. I think you need to push that. Same as when they're coming back through rehab, you do.
But as you mentioned, women are more susceptible to those injuries because of the dynamics during their landing, and all the prevention programs are geared towards that. Yeah. In SPORTSMED, we try to keep abreast of the newest developments from a technical point of view. The newest things that we're currently utilizing is robotic surgery. Robotic surgery gives us a lot of precision and a lot of feedback in performing operations and ensuring that from a technical point of view, we're at time zero, providing the best possible outcome to the patient. What I find very valuable working in so close proximity to yourself here at SPORTSMED is that I can come and bounce ideas off of you.
I find it excellent. That ability just to talk constantly and
yes.
easily access the other person makes a massive difference.
Makes a huge difference.
It's easy to say you can contact via phone or, you know, via correspondence, but face-to-face chats work really, really well.
The other thing I find helpful is the fact that we deal with such high-demand athletes or sporting people. It gives us the confidence to be able to manage the everyday public at a high level of confidence.
They are the absolute best in the business. Visit sportsmed.com.au to read about the amazing robot technology at SPORTSMED SA. Get in there.